I'll be uh, I'll be presenting some brief synopsis of my current research project that's supported by the National Science Foundation through an early career grant on looking at invisible and hidden populations during disasters, and specifically focusing in California on Latino and Indigenous undocumented migrants and how there's disparate impacts to them when an extreme wildfire event hits. This is important to understand because in recent fires, the economic impact of smoke taint is estimated to have cost the California wine industry $3.7 billion. Smoke taint occurs when smoke and ash permeate the skin of grapes, which can affect the taste and smell of wine. However, too much concern is often placed on the impacts to the wine industry, but not on the farm workers that are harvesting grapes during wildfire events and how their lungs are also being tainted. They are not provided with adequate occupational health and safety protections, let alone hazard pay or federal disaster funds to work in mandatory evacuation zones considered hazardous to the general population. So that's why the title of my talk is Tainted Grapes, Tainted Lungs, Lessons on Inclusive Wildfire Disaster and Climate Adaptation Planning for Undocumented Migrants. This is important to understand because in California, we are experiencing a major climate change crisis. In the last several years, millions of people have been impacted by multiple disasters, fires, blackouts, heat waves, drought, hazardous air quality, and of course, the ever-present COVID-19 pandemic. These compounding of disasters have cascading health, social, and economic impacts. And due to existing structural inequality, these impacts are disproportionately affecting low-income people of color. In essence, wildfires in California are not isolated disasters. They often now compound with other hazards and comorbidities, or what is called in the field of public health, a syndemic. So now more than ever, it's crucial to understand how these events amplify existing inequalities and how to lessen the resulting harms, particularly in the context of extreme wildfire impacts to undocumented Latino and Indigenous migrants. While this talk is based on the impacts to California's most marginalized and stigmatized populations, this research has global implications. California's wildfire problems are now impacting the world. In the year 2020, for example, smoke from multiple extreme wildfire events not only reached New York State, but also Western Europe. So California smoke is now impacting sensitive populations globally. Given their social status, undocumented Latino and Indigenous migrants are particularly vulnerable to disasters such as wildfires and require special consideration in disaster planning. They are disproportionately affected by racial discrimination, exploitation, economic hardships, less English and Spanish proficiency, and fear deportation, their pre-disaster marginalized status. So if we really want to tackle disaster risk reduction, it starts with the social integration of migrants before a disaster, including them in our social safety net for healthcare, unemployment insurance, disaster aid and resources from the federal government, and many more disaster services. And it's important to understand and acknowledge that disasters only exacerbate existing inequalities. So when a disaster like a wildfire occurs, it creates a hyper marginalization of this population, particularly because there is no social safety net for this group. Our research of the 2018 Thomas Fire in Ventura, Santa Barbara, and Ventura counties was developed in a co-productionist framework. Migrant rights and environmental justice groups that lived and worked during the wildfire disaster are my co-authors. They were vital contributors to the research design, data collection, and analysis. They were also key in presenting study findings to multiple policy audiences at the local, state, national, and international levels, including the United Nations Migration Agency, as well as the federal government, the National Oceanic and Atmospheric Administration, as well as here in California, the Governor's Office of Emergency Services. Moreover, this co-productionist framework shows that undocumented migrants are rendered invisible in the context of public policy by systemic racism and cultural norms regarding U.S. citizenship and who is considered a worthy disaster victim. Our research highlights how political choices are intentionally being made that prioritize some lives over others. Climate change is making wildfire season longer and more severe in California. Moreover, 17 of the 20 largest wildfires by acreage in California have occurred since the year 2000. Sonoma County, my new research site, is an epicenter for wildfires and a bastion of California's high-end wine industry. And it has suffered from multiple years of wildfires from 2015 to present time that have been ranked in the top 5 and top 20 of the most destructive and deadly wildfires in California's history. Cumulatively, they have burned nearly 1 million acres, destroyed over 12,000 structures, and caused 34 deaths. While climate scientists expect wildfires to become more frequent and severe, it is important to explore how some people and communities are more affected by these events than others. In California, while many of the fire-prone regions are largely populated by higher income groups, they also include hundreds of thousands of low-income individuals who lack the resources to prepare or recover from fire. These numbers will likely surge according to the California Fourth Climate Assessment Report, which projects that the state's wildfire burn area may increase by 77% by the end of the century. The state of California, however, does not have a comprehensive analysis of wildfire based on social vulnerability or demographic data. Outcomes occurring during and after wildfires have major environmental justice implications, in that certain populations, due to their socioeconomic status, must live with the disproportionate share of environmental impacts and suffer the related public health and quality of life burdens. Moreover, in our research, we investigate how human identities such as gender, class, race, indigeneity, and immigration status intersect with wildfire disasters. Sonoma County has been an epicenter of extreme wildfire and environmental justice within the state. Media outlets, governments, and scholars across the country, however, have largely focused on the loss of coastal and hillside mansions and impacts to wealthy homeowners and farmers. The Sonoma fires, however, not only destroyed expensive property and crops, but also endangered the health and livelihood of thousands of undocumented migrants. In this research, moreover, I highlight the forms of discrimination and unsafe labor conditions faced by undocumented Latino and Indigenous migrants during wildfires. As one resident of the region told me, undocumented migrants are the invisible population living and working behind the Bougainvillea curtain. They are struggling to survive in a region of wealth and prosperity. This idiom references the fast-growing evergreen vine with an explosive magenta color that adorns the gates of mansions and farms for added privacy. California is home to an estimated 2.6 million undocumented migrants, many who are farm workers or employed in service jobs such as housekeeping and landscaping. In Sonoma County, undocumented individuals are estimated to account for 8% of the population, or over 38,000 people. Furthermore, governments in California have often overlooked the needs of Indigenous migrants in developing disaster plans and policies. Sonoma County is home to a growing Indigenous Mexican population. It is estimated that over 12,000 Indigenous people from Mexico live and work in Sonoma County. Concentrated in labor-intensive sectors such as row crops and wine grapes, the work of Indigenous migrants increasingly contributes to the profitability and affordability of fresh fruits, vegetables, and wine. In particular, Indigenous Mexican people in Sonoma County are culturally and linguistically isolated. Many are illiterate, and some speak neither Spanish nor English, but only their native languages such as Mixteco, Triqui, Maya, Chatino, or Zapotec. It is important to note that Indigenous Mexican people are not Hispanic or Latino, but Indigenous. They are often homogenized with the general Latino population. To put this into context, why language justice is an important part of disaster and climate change policy, I will play a short audio clip of the Mexican indigenous language, Mixteco. And as you will hear, it sounds nothing like Spanish. As you can hear, Mixteco or Mixtec is quite distinctive from Spanish, but I often, when I do my policy briefings at the local, state, and federal, and even international levels, we have to highlight how culturally, linguistically, and racially distinct Indigenous Mexicans are, and you'd be quite surprised how many policymakers don't understand the difference. While disaster relief efforts and Sonoma fires have largely been praised as effective, migrant workers were especially impacted from the fire due to the loss of employment, violations of occupational health and safety standards, the lack of evacuation information in their native languages, confusion about eligibility for disaster relief services, and poor infrastructure and housing in migrant communities. Undocumented migrants' socioeconomic situation is usually precarious. However, the wildfire disaster intensified their already difficult situation. The Sonoma fires revealed how undocumented migrants and those with seasonal work visas require special consideration in disaster planning. These individuals are often afraid to seek help and restitution during and after a wildfire for fear of deportation. Undocumented migrants are also unable to access disaster relief services because of language barriers and an explicit prohibition from accessing federal disaster assistance programs. Moreover, the lack of occupational health and safety occupational health and safety standards are of key concern as intensifying wildfires collide with harvest season each year. In particular, undocumented farm workers are shouldering the burden of protecting Sonoma's wine grapes from smoke and ash, and actually being asked to enter into mandatory evacuation zones that are considered hazardous to the general population to harvest these grapes. And fine particulate matter, PM 2.5 from wildfire smoke, which is a toxic mix of heavy metals and other chemicals from burning structures and objects, can be several times more harmful to human respiratory health than PM 2.5 from other sources such as car exhaust. While the annual mean level of PM 2.5 has declined over the decades due to implementation of strong air quality policies to reduce emissions from controllable sources, the frequency and severity of smoke events with PM 2.5 exceedances has increased significantly in California due to wildfires. Since 2015 in Northern California, for example, the annual mean PM 2.5 has increased as a result of extreme wildfire events, and these events have actually overtaken as the main source of PM 2.5 exceedances. The harm due to wildfire smoke to farm workers, moreover, may be greater than previously thought, bolstering the argument for additional research and policies to help safeguard the most vulnerable and stigmatized populations. And for example, of these workers working in these mandatory evacuation zones or adjacent to fires that are heavily impacted by wildfire smoke, that toxic mix of particulate matter and other chemicals that are hazardous. One Indigenous farm worker told us in our research, quote, "We all got sick, our throats closed in from breathing too much smoke, and our kids couldn't go to school. We had to buy masks and medicine for our throats and some goggles because my eyes were irritated when I worked," end quote. This Indigenous farm worker, along with other farmers, would tell us that they would be working hours, days, sometimes even weeks, because these extreme wildfires can last over a month in some regions. They would come home and literally have black saliva. Another outdoor worker or landscaper told us, quote, "I could not get to the homes where I worked because of the streets were closed. 2 of the homes I worked at were destroyed. One of my good friends was lost during the disaster. He had only been living in an area for 3 weeks before he died. I myself am a cancer survivor and am the only one who provides for the family," end quote. So this quote from this outdoor landscaper is really important to understand that before a disaster like a wildfire occurs, they have existing health disparities that are only exacerbated from breathing in toxic smoke and being exposed for hours, days, or even weeks. So really understanding that disaster exacerbates existing health disparities when a pandemic comes or a drought or heat waves creates this compounding of disasters. Again, it creates and works in together intrinsically. It creates what the field of public health calls a syndemic. Also, other issues of concern in terms of public health, and particularly in terms of language justice, is all these emergency information and notices about shelters, about poor air quality, about mandatory evacuation zones, where none of them were put in Spanish or let alone any indigenous languages. The counties had no one, and again, this is in 2018 and 2020, no one to do live translations. And there's various stories about this that I can talk about during the Q&A. But one of the key things in terms of occupation of public health is these boil alerts that were not translated into Spanish. We can see this map of Ventura County. The red area on the upper top of the photo is the boil alert area, primarily low-income areas. They were not told about they needed to boil water. So obviously when a fire happens, electricity and other infrastructure are get knocked down. So that can contaminate our water systems, either from fecal matter or smoke and ash and other types of debris that can get into our water systems. And so obviously you would need to boil some of this water, but recent research out of Purdue says that a boil alert is not sufficient enough anymore, that we should be moving from do not drink unless you boil to do not use orders, because research has shown that weeks, even months after wildfire disaster, there are harmful chemicals in our community water system, such as benzene and other pollutants that can stay in the pipes. And obviously, if you heat that up, it magnifies that process, that makes it even more hazardous to individuals. Do not use to even shower, particularly for children. So again, in research at Sonoma showed that benzene and other chemicals, particularly more hazardous to children, were in the water system for weeks, even months after the wildfires up in Sonoma. So we need to move away from the boil alerts to actually do not use alerts till we understand what exactly is in our water systems after a fire. So to conclude, before I conclude, I want us to think about a major research implication about thinking beyond property values and expand our wildfire research. Current disaster policies render many minority and poor communities invisible. As the case of Sonoma County shows, migrant communities are among the most impacted during wildfires. Unlike race and ethnicity, immigration status has received little attention in disaster vulnerability research. Current disaster policies also fail to account for the complex web of effects that wildfires have far beyond the destruction of property within the perimeter of the fire itself. For example, toxic smoke flows down from burning mountainsides, settling in densely populated valleys below, threatening outdoor workers. Lavish hillside mansions are destroyed or evacuated, leaving low-wage migrant gardeners, housekeepers, and caregivers unemployed. Tourism throughout the region shuts down, putting thousands of hotel workers out of work. From the loss of housing and infrastructure to the closure of schools and job sites, the affected area is much larger than the footprint of the actual fire. For instance, a low-income migrant family living outside a burned area might lose several weeks of wages and be ineligible for federal assistance. They stand to lose far more than a higher income homeowner within the fire risk zone, whose property is replaced by their insurance policy, which also pays for hotel accommodation in the interim. So if we really want to tackle disaster risk reduction, it first starts with the social integration of migrants before disaster. So this involves including them in our social safety net. And we should also acknowledge that disasters only exacerbate existing inequalities for undocumented migrants. In essence, disaster again creates this hyper marginalization for this population. For example, if we look at this picture of this little girl wearing an N95 respirator mask, I think we're all desensitized to that picture of little children with N95 masks. But if you look closely, that picture was taken in 2017. So this community, these children have been living with these multiple forms of disaster for many years than the general population. So again, highlighting, if you want to tackle disaster risk reduction, again, it starts with including migrants into our social safety net, giving them healthcare coverage, post-exposure occupational health and safety protocols in particular. And to conclude, I just want to highlight that this research has been very public facing and been really intended to have an effect in our disaster planning. For example, our research has been provided to community experts and to policymakers at the local, state, and national and international levels. For example, my research was utilized by the Office of California Governor Newsom in 2019 to develop a $500 million disaster grants for socially vulnerable communities. They also cite this research as instrumental for their annual California Impact Report. This scholarship has been further highlighted through qualitative methods webinars with the National Oceanic and Atmospheric Administration, the National Academies of Science, Medicine, and Engineering, the United Nations International Organization for Migration, among others. And it's also been profiled in numerous news media outlets. So just really honing in about the need to not only create research that is collaborative and co-produced with the with communities that are at the front line of disasters, but also giving them a space to be able to present research findings to policymakers and influential public health and occupational health regulators as well. So to sum up, here are some key findings that we're seeing from the recent fires in Sonoma and parts of the Central Coast, that there's vague statewide guidance for implementation of worker health and safety. There's not a uniform standard. It's done in sort of a county by county basis. The state hasn't really stepped up and put it in stronger guidance. Cal OSHA, which is the State Office of Occupational Health and Safety, has limited staff and only 26 Spanish-speaking field investigators for the entire state of California. And as far as we know, none of them speak any indigenous languages. And a side note, when the fire occurred in Ventura and Santa Barbara counties, there was a regional office of Cal OSHA there, and they actually closed that office because it was too dangerous for the field investigators to do their work, and they didn't reopen it until migrant rights and environmental justice groups protested to leaders in Sacramento for them to reopen that office. There's also an even N95 mask implementation throughout the state. When the air quality index reaches 151 or higher, employers, farm owners, and supervisors need to pass out N95 respirator masks. We're being told that's not happening during these wildfires, let alone for COVID. Access verification permits are what allows farm workers or employers to allow their farm workers to enter into those mandatory evacuation zones. Again, these are established ad hoc administratively, not by legislative action. So there's really no strong protocols about when a permit is approved and what are the safety standards, including if employers need to have an emergency disaster plans when they do let workers and farm workers into these sites. Most importantly, there's no post-exposure health test for these workers that are working in these toxic air quality regions, either in a mandatory evacuation zone or downwind where the toxic smoke is flowing down and how that's exposing them. And there's also improper monitoring of air quality index. As I mentioned, they need to understand what the air quality index is, but usually this is stationary government monitors that are miles away from the job site. So these are not real-time monitors that are actually on the job site to really tell you what the air quality is. And there's also inadequate field sanitation. So, we know COVID-19 pandemic, cleanliness is a key issue. Just imagine in a wildfire where smoke and ash is coming and you don't have somewhere to go to the bathroom, let alone wash your hands. And then finally, there's unclear water quality alerts and monitoring after fires that needs to be done. And we need to legitimize migrant indigenous community knowledge and lived experience in disaster planning. To sum up, embrace community groups and migrant communities into disaster planning, response, and recovery. And then finally, bolster Latinx and indigenous civil society organizations' capacity in disaster relief and planning efforts. I'll talk more in the Q&A, but there's really no government response for this community. So migrant rights groups are digging in their budgets and their under-resourced budgets to buy N95 masks, provide a private disaster relief fund for individuals ineligible for federal disaster, and they're not getting reimbursed for this. So this is what this is really talking about. And there has been some progress in terms of laws passed, but I know I'm up on time, but I'll be happy to talk a little bit more about what laws have been passed to change some of this inequitable issues and what other further recommendations are we proposing to policymakers. So I just want to thank you for this opportunity to give you a brief understanding of what is going on in terms of occupational health and safety and social inequality for undocumented migrants, both Latino and Indigenous. So thank you for this opportunity.
Thanks, Dr. Mendez, so much for just a really rich talk. And we do have some questions, so I'm glad we have some about 30 minutes to explore this topic more. And so, Dr. Mendez, I just want to start out with a question first. I believe this probably comes from a student, and this might invite you to say a bit about maybe your own trajectory to kind of getting involved in this research and becoming a researcher. The question asks, what are the steps towards getting involved in conducting research like this? So like kind of what was your path? How have you gotten into this research and started to do this work? I'm sure that's a long story in some ways, but can you kind of give us a bit of a sliver of that?
Sure. Thank you for that question. I think, really highlighting people's lived or embodied experience is important, and really acknowledging that we all have a positionality. We all have our certain perspective in the world that informs our research. And research science is not a value neutral process, neither is the policymaking process. So I came to this research on environmental justice, on climate change and public health, really because I grew up in Northeast Los Angeles, in the Northeast San Fernando Valley, largely Latino immigrant community that faced multiple environmental threats. And I really saw community groups and policymakers really step up and really question about how these environmental inequities originated, to demand answers and to imagine alternatives and more practical solutions to redress some of these issues. So that really motivated me to question what made our cities, our communities look the way they do. So that led me to urban planning, or environmental planning in particular, and policy making. And before coming into academia, I spent about 10 years or so in the legislature, in the Capitol, working on these environmental justice issues, because I really want understanding that partly this is political in nature, about how our communities, how we prioritize who should be safeguarded and protected, or as I mentioned earlier, who's considered a worthy disaster victim. I know that word victim is very disempowering, but I along with my co-authors use it intentionally, that these individuals are not even allowed to be called victims. They're rendered invisible in the context of public policy and their disaster relief infrastructure, like they don't exist at all. And their impacts don't matter. So that's why we intentionally use that word victim. But yeah, so I grew up in those areas and really wanted to engage in this issue, both legislative and politically, but then I really wanted to have my own voice. So I started pursuing a doctoral studies for I can investigate this and have sort of my own ability to engage and influence the policy and political process. And as I started to progress in my career, I really saw the need to I can't do it all the time, but as much as I can, to engage in what co-productionist or community engaged scholarship, and including them in the research design, asking them, what should we study? How should we study it? And getting their own policy implications and research sites that makes this research so important. And Michael mentioned all these awards that I won. I wouldn't have done it if it weren't for them, and I wouldn't have this rich research if it weren't for these community groups. And so I guess that's sort of a really brief kind of synopsis of how I came to this research. You're muted.
Thank you. Nayeli writes, what has been done for improving the language barriers informing individuals about environmental hazards and the resources you were talking about? Because you mentioned that was a problem,
Sure.
Particularly around drinking water. So what is being done, if anything, to improve that?
Yeah, like all emergency information, it was a problem. And to give you a little bit more background, so in the Thomas Fire, which has been Ventura and Santa Barbara counties, this was in 2017 and 2018. I say that because it started in early December, didn't end until mid-January 2018. So over 40 days it happened. So in the first 10 days, the counties had not assigned a public information officer, no one to do live translation. And everyone thinks California is so forward and progressive thinking that there's this Latinization of the state government and all our political systems. That's not the case, particularly in our agricultural areas. And so when this fire was breaking out, they didn't have it translated. So these migrant rights groups, indigenous migrant rights groups, had to go on their social media, Facebook, WhatsApp, text messaging, which a lot of migrant communities use to translate it. They had a low power wattage radio station. They were translating in Spanish and Mixteco. So what the government was doing, like maybe by the second day, they had an advisory says in Spanish, one sentence: if you can't read this, please take it to somebody that can translate it to you. 2 days later, they put a Google Translate app section to translate the information. In 2018, many of us know Google's Translate was not that great. It's still not that great. And it was translating words from words in English like wildfire to hairbrush in Spanish. So those were the major forms of language injustice. And again, live translations didn't happen until 10 days after this major fire happened. Political pressure was sent to Sacramento. The governor's office of emergency services lent somebody to do translations. So subsequently, these groups had passed a language competency bill, not requiring everyone to have a live translations, because that's sort of an unfunded state mandate, but creating these sort of templates that counties actually had to create for emergency information and do it in the most commonly spoken languages. So at least these emergency management offices at the county levels throughout the state now have these library of templates that they could kind of move and match emergency information. And then also some grant funding now for disaster aid is tied to ensuring that you do have translation and interpretive services, as well as disaster planning that includes socially vulnerable populations. That's also culturally appropriate as well. So that cultural competency as well. So there was a couple laws passes that sort of moved the needle of progress forward a little bit.
Thank you, Dr. Mendez. So not a question, but a comment from CSCB President, Dr. Lynette Zelezny. So thanks for being with us, Dr. Zelezny. Just says thank you for sharing your scholarship and expertise with CSU Bakersfield, Dr. Mendez. A key takeaway: disasters drive hyper-marginalization. As an environmental psychologist, I better understand the urgency for environmental justice. You honor our university with your research and strong voice. With gratitude, President Lynette Zelezny. So I just wanted to give that shout out. Thank you, Dr.
Oh, wow.
For with us tonight.
That's the president of the university?
Yes.
Oh, wow. Thank you. Thank you, President
Zelezny.
Zelezny. Thank you.
Let's see, a number of good questions here. So this comes from, I'm probably going to mispronounce this, so my apologies in advance. It's either Sima or Chima, who talks about, so critics from, say, right-wing policymakers from that orientation would probably consider this a political issue in this divided nation. How does one lay the groundwork for an argument for social safety nets for non-citizens in that context?
That's a very difficult one to answer, and it's polemical for all counties. I'm actually headed tomorrow to Chicago, so I'm participating in NALEO, which is the National Association of Latino and Appointed Elected Officials. So this is the second time I've been invited. I've been invited to moderate a panel on climate change and disaster impacts to Latino communities in general. And one of in our prep calls, we were actually talking about that. So this is a national association. It's not just Southwest Latino policymakers. It's people from Nebraska, people from southern United States that are experiencing the influx of immigrant communities. They're the new gateways, right? Because they're not going to California. They're not going to Los Angeles, New York, San Francisco, or even Bakersfield for as much as to these new immigrant gateways. And how do we talk about these issues in a way that they might be the only Latino council member maybe a supervisor, and they're sort of a lone voice and vote. And so the idea is really showing that these impacts are happening to our entire community. Of course, it's happening disproportionately to in the Latino community, to undocumented migrants that are not part of the social safety net, but really focusing on issues of historic disinvestment in Latino communities, particularly around infrastructure. So there's a lot of aging infrastructure. Sorry, my dog's over there. A lot of historic aging infrastructure in Latino communities because of disinvestment. Some of it racialized as well, and our infrastructure is crumbling. So if we can maybe focus on safeguarding our communities and upgrading our infrastructure, that's like one way that more conservative regions can safeguard some of the most vulnerable populations is through that infrastructure realm. We saw Hurricane Katrina, it's at Ward 9, heavily African-American community was never safeguarded. The infrastructure, the levees, were the money was never put in place. So I think using a different, the similar frame of upgrading and infrastructure, reinvestment in Latino communities in general is one aspect. And the second aspect is co-benefits, multi-benefit policies. If you're a coastal community, you're in Texas or something, and you're worried about storm surges, what kind of green infrastructure can you do that provides recreational opportunities, green space, because many of Latino communities don't have green space, but also protects the local community from storm surges or sea level rise. So those are co-benefits or multi-benefit projects. So I'm glad you asked that question, because we were actually at our prep call yesterday, we were literally talking about more conservative regions or more moderate regions of the state, of the country, that again, a Latino member might be the first city council member and the only Latino council member on that body, legislative body.
Yeah, great. I think being able to speak kind of across political polarization, particularly with issues as important as these, is important, right? Important consideration. So thanks for that response, Dr. Mendez. Dr. Mendez, this question comes from Marie Claire. She says, hi, Dr. Mendez, thank you for this talk. I'm a grad student at Yale Public Health studying natural disasters. Since wildfires are so common in California, I'm curious if you've looked at effects of cumulative wildfires on social well-being and/or policy changes.
Sorry, can you repeat the question again? I'm sorry.
Sure. So the crux of it is, since wildfires are so common in California, I am curious if you've looked at effects of cumulative wildfires on social well-being and/or policy changes.
Not statewide. Only in my research sites. So my research sites, it's largely coastal California. These are the agricultural wine country or luxury crops. So that's why these migrant farm workers are often asked to enter into mandatory evacuation zones to harvest the crops, because these are luxury crops. These are wine grapes, berries, those high yield type of crops that are grown in the coastal regions. So those are the two, Ventura, Santa Barbara, and Sonoma, that I'm looking at. So when I started the project in Ventura, Santa Barbara, that issue didn't come up as much because they've had maybe one or two fires, both really big, one really big, one moderate. But Sonoma has had multiple years of extreme wildfire events. And so this issue from a psychological perspective, this issue of trauma has come up more. So this disaster fatigue, mental health, and then the lack of resources. If you don't have healthcare, you're not going to have mental health coverage, obviously. And so, and sort of in the Latino population in general, seeking mental health services is sort of taboo or stigma. So how these individuals, again, it's another form of a compounding or issue that we're not talked about as much within families and worker groups. But it's something that in our interviews, we do see people are talking about more and more than they used to.
Dr. Mendez, this question comes from Dr. Nate Olson. I'm wondering what implications your work has for how fires are fought. My understanding is that firefighters' first priority is to protect human life. but I'm not sure whether they consider impact from smoke under that criteria. Do you think your work shows that we should shift firefighting priorities?
Well, there's some great studies on public health exposures and long-term health exposures of firefighters, and because of these wildfires, and it's focused on California. I don't know the author, but I've seen them, and those incidences of respiratory diseases and cancer from those working in these wildland wildfires has significantly went up. I can say, I'm not no by any means I'm not advocating should firefighters not protect areas. It's more of a policy, a political decision about our urban planning, because we have climate change, but climate change is not the only a driver of these wildfires. It's our forest management practices. We don't do indigenous and types of practices. We don't do management burns. We also have the expansion of the urban wildlife interface. So meaning more and more urban development is happening in these forests that creates more vulnerabilities for fires. And a lot of these fires are human induced, started by a human or a lightning or electrical fire, but our climatic conditions, drought, heat waves, are exasperating that, and sort of, while it's not, climate change is not the driver, it's a contributing factor, whether it be human error or it be some natural event like lightning.
Thank you. Let's see here. Just looking at the questions. So this question comes from Brick. So given that there are inequities for those at the lower levels of the economic ladder in many spheres of our society, are there other ethnicities alongside Latino and Latina indigenous populations that are affected or equally or substantially by these inequities that you're talking about?
Yeah, so I think people of color in general are affected by disasters disproportionately compared to white wealthy communities. I highlight here, and I make the distinction, one of the most marginalized and stigmatized. So these groups being undocumented is a stigmatized status. So how does that exasperate during disaster? So I try to make that distinction. I'm not saying that other people of color are not impacted by disaster. They definitely are. We've seen Hurricane Katrina that I mentioned earlier. We've seen Puerto Rico, Hurricane Maria. The recent hurricanes or storms that happened in New York show that Asian American or Asian immigrants, API immigrants, were equally impacted from the disasters. The Intercept, and I can't remember, maybe it was The Guardian, did some really human-centered or people-centered news coverage of those fires, of these people, of these immigrants, Asian and Latino, both living in substandard housing in basements, and how some of them were, I think, one or two drowned, but many of them were living in flooded conditions in basement because that's all they could afford in New York. So we see that in Texas too. The recent freeze that happened a year, or was that a year and a half ago? You see multiple groups being impacted, but largely people of color.
Melissa asks, what progress have you seen as you've worked on these issues? Progress for farm workers' rights feels so slow so often.
The biggest thing is mobilization and self-determination. I know I provided a lot of the negative impacts. My book, for example, is very uplifting and shows very strongly self-determination. With this, it's such a new policy area. It's important to provide that narrative and framing of these disparate impacts and how significant they are for this community that is often rendered invisible. But there is a lot of self-determination, a lot of agency of these individuals. They're really coalescing, coming together, and migrant rights groups are becoming disaster and climate adaptation experts in their own right, not because they wanted to, but they're forced to do this because in many regions and many parts of California and throughout the country, there is no official government response for this community. So they have to essentially be the frontline workers or the first responders for their own communities. And so they're having a lot of experience year after year of these disasters, and they're learning, and they're getting a very good at the work that they do, and also very I wouldn't say confrontational, but very aggressive is kind of necessary, but very active in these disaster infrastructure policy arenas, from the Red Cross, the Salvation Army, to obviously county emergency services. And they're starting to demand that they be included, the migrant rights organizations be included in disaster preparedness, provided with resources, and be consulted and collaborated with for some of these disaster planning. So I see that happening. And then another issue is with COVID-19 pandemic, so particularly around wildfires. So these wildfires have been happening at least since 2015, but really hit hard in 2017 in multiple parts of the state of California. And so these groups have been learning the lingo, the terminologies, and disaster relief practices for several years because they were forced to. And so when the COVID-19 pandemic hit, it really disproportionately impacted migrant workers, and particularly farm workers. But in my interviews that I'm doing with these groups, they told me, had it not been for the disaster planning and efforts and services they did since 2017 or even 2015, that the impact of COVID would have been far worse for that community. So they had sort of a built-in infrastructure and network to kind of adopt from wildfires to COVID-19 pandemic. Not obviously, it's not the same, but there was a sort of a base for them to work from. And they had made connections with some of the key disaster or mutual aid organizations because of the wildfires. So that's sort of a really positive self-determination example. And now we're talking about, and I'm helping to assist them through some of the big federal grants that I got to create a national, a statewide, that is, statewide convening of all these migrant rights groups and a few environmental justice groups to come together from some of these disaster zones where they can have a convening. They're already talking to each other, but this would just bring everyone together and kind of be more proactive instead of reactive to the next disasters that we know will happen in California, because these disasters are not unanticipated. Unfortunately, they're not unanticipated events anymore. Wildfires, heat waves, droughts, and of course, earthquakes. And now pandemics are something that we're going to have to live with year after year or for the coming years. So we have to prepare, and they want to be more proactive.
Can you talk a bit about, so you research your kind of field work with undocumented populations and indigenous populations. I imagine there might be in some cases, some wariness maybe to engaging with a researcher, right? Even somebody with the background that you have and the experience you have. So what are the ways that you make those connections and build those relationships to actually do the kind of field work that you do as part of your research?
That's a great question. You really have to move with the speed of trust. You have to have relationships before you into this research, and unfortunately not every researcher can have that off the bat. I had the privilege to have worked in the legislature and on these environmental justice issues. So I started to build a relationship with some of the statewide and some of the regional organizations, and they started to introduce me to folks, and they vouched for me, and that's sort of how I kind of went about it. And then this wildfire research, the first article that I did, I actually didn't intend to even do that article. I was looking at more of intersectionality and sort of how migrant rights groups and environmental justice groups are creating a social movement together and protesting around climate change issues, and sort of this new, unique, emerging kind of intersection of two social movements, and why climate justice is important to immigration rights, why immigration rights is important to climate justice, and vice versa. And then everyone kept on telling me, oh, you need to talk to Lucas at CAUSE, which is an environmental justice organization, and Genevieve at MyCup, which is an indigenous rights group. And I did, and I'm like, wow, this is amazing. And I just abandoned the project afterwards and said, no, I want to do this one. And then I started to do like sort of scoping or like informational workshops. I had one at Yale when I was teaching at Yale, and I had Yale money, so I had money to create this workshop. And I brought the migrant rights, Indigenous leaders and environmental justice activists, as well as policymakers together, along with my students, and we all kind of started to map out what was going on, what were the key policy implications and themes. And I started to do that, and I'm like, wow, I can't do this by myself. And what Genevieve and Lucas would bring into the to the analysis and the conversation is so rich and so important. And so I asked them to be my co-author that dinner after our workshop, and they were really happy about that, and particularly because of the sense of ownership, sort of data justice, that they get to own the data, they get to own the published work as well, co-own it with me as well, and that they can actually use that in their own arenas to advocate and have sort of a credibility of a top academic journal to do it. And we, of course, we did more public-facing policy briefs, fact sheets for the news media and for policymakers to ensure that it wasn't just academic research, but it was easily accessible and translatable to the general public, journalists, and elected officials.
So I think this is like a good fitting last question for our evening tonight. It comes from Genevieve. Says, thank you for this informative talk. I was ignorant to this problem. I was wondering if you can share a few ways that I guess just kind of people from general backgrounds, maybe non-researchers, can help to improve this social justice issue.
As researchers or general individuals?
I'm thinking more kind of like general, like open access, like kind of ways that just persons from multiple walks of life might be able to get involved in something like this.
Well, the biggest thing is vote. I think you need to vote. Everyone, and particularly Gen Z and younger millennials, often think that their vote doesn't count. But it does, and if the vote didn't count, they wouldn't be trying to take the vote away from African Americans in Georgia, Latinos in Texas and Arizona. So every vote does count, and elections do have consequences. So the midterms are coming up. Here in California, in June, we have June primary. You have state senators, state assembly members. I'm sure you'll have city council members. You should always ask these individuals, particularly at the local level, because remember, a city council member eventually wants to be a Congress member or a state senator, so they have higher political aspirations. So you should ask them at the, even at that local level, what is their stance on some of these issues? So if you care about climate change, then you should ask them about climate change. If you care about public health issues, you should ask them about that. So you should always, question these elected officials about some of the issues that you care about, because again, they're going to be enacting laws and policies and moving up that political ladder eventually. So every vote counts.
Thank you so much. And just again, want to thank Kaiser Permanente for sponsoring our event tonight and helping us create this series and host this wonderful lecture and conversation. And Dr. Mendez, thanks so much for taking time out of your evening to be with us tonight and to share this important knowledge. We appreciate it.
Thank you. It's been an honor, and thank you for everyone that attended today.
Sure. All right, everybody, be safe, take care, and we'll see you next time. Have a good night.